Drug diversion is the unlawful channeling of regulated pharmaceuticals from legal sources to the illicit marketplace. In simpler terms, if controlled substances are taken by someone whose name isn't on the prescription, that is drug diversion. Drug diversion can and does happen outside of a healthcare environment, but healthcare facilities are particularly vulnerable because of the ongoing access people may have to controlled substances. The majority of drug diversion incidents involve someone diverting medications for personal use, for use by others, or for financial gain. But in the majority of cases, diversion is fueled by addiction. 1 in 10 Americans have a substance use disorder. This statistic includes both drugs and alcohol. This is thought to be even higher among healthcare workers. It is generally believed that this is due to several causes: stress, knowledge of drugs, a tendency to self-medicate, access to controlled substances, especially opioids, and a belief that their additional understanding will help them to control their use. The American Nurses Association estimates that at any given time, 6 to 8% of nurses are practicing while impaired. And while this includes both alcohol and drug use, over the last 2 decades, Minnesota's statistics show an alarming rise in the misuse of opioids. The opioid epidemic continues to demonstrate that addiction has few demographic boundaries. While addiction can be the result of reckless recreational use, it can also develop in other ways. It can affect people who don't fit the stereotype of someone whose risky behavior might lead them to abuse. People who have no intention of using opioids irresponsibly can become dependent during exposure from episodes of acute injury or after medical procedures. They are prescribed opioids during a surgery or as part of the response to an injury. The issue comes when they cannot wean themselves from the opioid medications, either because of continued pain or because of addiction. At some point, a prescriber will refuse to continue prescribing the medication. So, driven by pain or addiction, the person looks to obtain opioids in another way. When that person is a healthcare provider, access to opioids at work can be a huge temptation. The fear of withdrawal symptoms or pain can lead to desperate, out-of-character behavior. Addiction can last far longer than the visible injury or illness. A person may experience chronic pain or may be completely recovered but still addicted to opioids. What that looks like across long-term care in Minnesota is concerning. This chart shows the number of substantiated drug diversion investigations in assisted living environments over the most recent 3 years where we have data. This is what it looks like in nursing homes across the state. There are around 370 nursing homes in Minnesota. If the most recent year was dispersed evenly, more than 10% of nursing homes would have had a substantiated incident. When we look at this cumulatively, this is almost a 10-fold increase across the most recent 3 years where we have data. While most clinicians will never divert controlled substances, we know it's happening, and it's concerning. So we know drug diversion is happening and can happen at any facility, but how does it affect residents? Each situation is unique, but diversion can leave your residents without doses of the medication they need. This is neglect. Residents can be charged for medications they did not take. This is exploitation and financial abuse. And residents can receive care provided by someone under the influence of controlled substances. This can put them at far greater risk of harm. Each long-term care facility has systems in place to decrease opportunities to divert and systems in place to identify when someone is diverting. The most important of these systems is the chain of custody. This means that we know who has had access to or is responsible for controlled substances at all times. From the time a medication enters the building, it is checked in, securely stored, and someone is responsible to make sure access is appropriate. Facilities should also be completing a controlled substance count at every shift and handoff of nursing care. Take a second to think about how your home operates. What are some times or situations in your facility when the chain of custody could be compromised? While this is not a comprehensive list, these are some things we have seen that make a facility more vulnerable to drug diversion. A propped medication room door, improper access to the medication room, unsecured keys, unsecured packages from medication deliveries, or an unlocked, unattended medication cart. Issues can also happen when residents want to delay taking medications that have already been prepared. There may be others, based on each facility's systems, staff, specific resident situations, and layout. While this may seem like just a nursing issue, preventing drug diversion is everyone's responsibility. Everyone in the facility has a responsibility to be observant and to report anything that seems suspicious. If you see something, say something. Talk to your leadership about your facility's specific process for reporting, especially during evening and night shift hours. Leadership has a responsibility to follow up and investigate reports of suspected diversion. What am I looking for? Anything that appears suspicious or where something seems off. Staff or visitors in places where they don't have business, especially med carts, medication rooms, nurse servers, or places where controlled substance waste is stored. Residents who may not be receiving their medication, for example, a resident who always seems to be in pain when a specific nurse cares for them, especially with residents who have cognitive decline or communication issues. Clinicians who ask you to make exceptions to policy or process. How do I report this? Report your concerns to anyone in leadership at your facility. This may be your supervisor, the director of nursing, or the facility administrator. What can I expect when I report? You will probably be asked to write out your observations and date and sign the summary. The facility will complete an investigation. When the count is off, if you are a nurse and the count doesn't reconcile, both nurses who are counting should look for what could have happened. Even if you figure out what happened, the nurse who is staying needs to document it, usually via an occurrence report, and it needs to be reviewed by leadership. If you cannot figure out what happened, it becomes a suspected diversion event that must be reported immediately. If a controlled substance is missing, employees in that neighborhood or unit are not allowed to leave the facility until the assigned leader gives permission. If you have an addiction problem, there is help available. It is important to get help before you cause harm to others. The Federal Substance Abuse and Mental Health Services Administration has created a resource for people who need help with substance abuse or mental health issues. If you are a licensed nurse, Nurse Peer Support Network in Minnesota also is a good resource. Those websites are listed here. Take a moment to think through your answer to each of the following questions. If you aren't sure of your answers, you can go back in the video or discuss what you are supposed to do in your facility with your supervisor, the director of nursing, or your home's administrator. What is drug diversion? What are 2 ways diversion can harm residents? What are some medication security risks you need to be aware of in your specific facility? Who has responsibility for controlled substance security? What are 2 things you specifically can do to decrease the risk of diversion at your facility? How or to whom do you report suspected diversion? What would you do if you knew that a person you work with needs help with controlled substance addiction? Thank you for the work you do to care for residents and to keep them safe.